From Elanco, this is Rediscovering the Power of Healthy Animals, the podcast that explores how healthy animals, from cats to cows, can help us overcome some of today's most critical challenges. I'm your host for today, Dr. Tony Rumschlag. You're listening to episode 13, Virtual Veterinary Care, How Telemedicine Will Influence the Future of Animal Health. On today's episode, we're going to discuss the rise in telemedicine in veterinary care and how the COVID-19 pandemic has impacted the way we treat animals as we define the next normal. As part of efforts to flatten the curve, social distancing and stay-at-home orders have limited the interactions between veterinarians and animal owners by reducing clinic hours and changing the way animals are treated. Telemedicine use skyrocketed during quarantine as many veterinarians expanded their virtual care services to connect with animal owners in their home as well as parking lots. Here to discuss the recent progress in telemedicine and how it'll shape the future of veterinary care, I'm joined by this month's guests, Dr. Smiley and Dr. Apryle Horbal, both practicing veterinarians. Aaron is the president of the Indiana Veterinary Medical Association and an advisor on the topic of telehealth. Apryle serves as president of VetNOW, a telemedicine platform she founded to increase access to animal care. Thanks for joining us today, Dr. Smiley and Dr. Horbal. We're excited to have both of you on the podcast.
Thanks for having us.
As veterinarians, you've both integrated telemedicine services into your respective practices even before the COVID-19 pandemic. Can you tell us more about the why and how you've implemented this type of care and the impact it's had on your patients? Why don't we start with you, Aaron?
I guess I'd take it back a little bit. Veterinarians, they are very good at telemedicine, and I had been offering telemedicine since I got out of practice. I started in equine ambulatory, so the offering of telemedicine for me, free telemedicine, has been going on since the day of graduation. Paid telemedicine started to manifest itself at our clinic, to be honest with you, out of frustration. And the frustration was wanting to provide good customer service and allow the clients to interact and engage with me, and at the same time be able to monetize that professional service. So I tell the story pretty routinely of a client that got my cell phone number from a friend of a friend of a friend, and the conversation, and I'm sure all your listeners that are veterinarians can relate to this, just really was frustrating because of the lack of, maybe respect, but maybe just as far as respect for personal time that happened over these text messages. And I thought, oh my heavens, there has to be a better way.
My journey to telemedicine was a little bit different because we focused more on the vet-to-vet connection, so the vet-to-specialist connection. But once again, it was from my practice. So I was operating a specialty practice for companion animals and horses in Pittsburgh, Pennsylvania. I'm actually an equine veterinary dental specialist myself. And our issue came when we, had clients come in for emergency cases and recommended that they see a cardiologist or a neurologist or a dermatologist, which we weren't able to recruit on site. We very quickly discovered at our specialty hospital the shortage of specialists that is out there in the US and Europe as well, we know now. And so we created VetNOW as a way to bring specialists into our hospital, actually, from the outset. So we were doing cardiology and dermatology consults by video from our emergency vets with specialists that were around the country. And so we then created a software platform to really enable those visits to occur more seamlessly. And then as the specialist to vet connection was improving over time, we added on the ability for vets to talk to their patients and clients at home as well. And so it really was born out of this desire, not necessarily to connect with owners from the outset and patients at home, but it was really the desire to get a wait time for a cardiologist down from 2 months to 2 days. And it was, the ability to get a pet connected with an oncologist. The wait time to see one in person was a month and a half. And so if we could get a pet, on a chemotherapy treatment much sooner than that, that was really where, our solution was born from. So slightly different, but with the same sort of spirit in mind.
So let's talk a little bit more about the impact on the patients themselves or impact on the pet owner, animal owner. So April, just back to you. You mentioned a little bit about that, but can you expand a little bit more? I mean, what's the impact been as far as the owners?
Yeah, it's been very multifaceted, right? From the outset, the owners were very happy, even though they were still physically coming to our office. The ability to see a specialist much more quickly and get that kind of care was very, very fulfilling to the owners. They also loved the idea that they could still continue to work with their veterinarian that they trusted and still get that specialty advice. But fast forward to, that was 2 years ago that we began this initiative. Today, it's really about connecting owners and their veterinarians because physically they're limited in what they can do due to coronavirus. And so the ability for owners to stay in touch with their vets, we're hearing, is really a relief for them. When the lockdowns first started in our country and when people started to find these stay-at-home orders, when they found out that their vets had a telemedicine solution in place so that they could stay in touch with them, the relief was actually the feeling that we were finding more and more from our clients. So that was a very interesting thing that we didn't expect to happen was the pet owners simply being thrilled that they would have a solution to access their vets while the lockdown was in place.
Thanks, April. That's pretty impactful. Aaron, I'd be curious to hear from you. Same kind of thing. What has been the impact on your pet owners or your patients?
The impact that we see with pet owners is an enhancement or an improvement of the VCPR. So that veterinary client-patient relationship strengthens when the client knows that she has the ability to reach out to the veterinarian. It's a monetized situation, so it's not exactly the same all the time as far as just sending a friend a text message. But it is, like April was saying, a relief to the client that she can reach out and send a text. Last night, I had an owner a dog that had diarrhea that didn't improve, and she could send me a text message and say, "Hey, Dr. Smiley, what do you think?" And we talked through. So she was able to access an expert that she knew. That's very, very endearing and bonds her to the practice and to the veterinarian. On the patient side, it improves outcome. And I would just say anecdotally, anytime you bring the veterinarian closer to her patient, you improve outcomes, because instead of the client having to ask Dr. Google or Aunt Sally, she is going to ask her veterinarian. That improves outcomes.
So it sounds like it's both a little bit of improving outcome as well as that client peace of mind on top of that. When the COVID-19 pandemic set in, veterinarians quickly adjusted clinic procedures to limit their interactions with the pet owners. And therefore, we saw a rise in telemedicine services among veterinary practices, in addition to other updates like the curbside appointments. As we look ahead to the next normal, what aspects do you think will carry into the future? April, I'll start with you on this one.
Yeah, I think that a lot of what we're seeing will at least remain for some time. I think that the curbside appointments and the latest report from the AVMA said that 98% of veterinary clinics were still limiting physical contact with clients. And so we are, I think, still going to see these lasting effects as veterinarians realize in some ways they're more efficient without having the clients in the room, that some vets have actually realized that. And so they're going to keep maintaining some of those physical barriers. But at the same time, the telemedicine enabling clients to really connect with their vets from home and connect with specialists from afar, I think vets have realized that that's an integral part of their practice from a convenience standpoint right now more than anything, both from their part and the client's part. I think long term they'll start to recognize really the financial benefits of it as well, as Aaron was referring to earlier, in terms of monetizing their time, in terms of really drawing their expertise to the forefront, and clients realizing how valuable purely the veterinarian's expertise is in certain situations. I think that those are some of the long-lasting effects, that by really condensing the adoption of telemedicine into a few months as opposed to what was initially predicted to take 10 years, the next 10 years, that's really what we're going to be seeing now, is that realization of the benefits of telemedicine from the general public and from the veterinarians overall.
How about you, Aaron?
I think it depends greatly on if the veterinarian can figure out how to monetize the exchange. Because telemedicine will outlive COVID because it was here long before COVID. And one of the things that we're excited about in Indiana specifically is how to leverage those veterinary nurses or those veterinary technicians in indirect supervision. So I think that'll be a thing to monitor in the veterinary community, are the clinics and the veterinarians that find ways to indirectly supervise their technicians through telemedicine.
Excellent perspectives. I like that. Beyond limiting human contact during the pandemic, telemedicine also has become popular as consumer behaviors evolve. There's a lot of pet owners who don't regularly see their veterinarian, and there's an increasing desire for convenience. How does telemedicine meet the need for the pet owner?
So I think that it's more than just the pet owners for convenience as well. I think this is a fantastic point that yes, this is convenience for the pet owners that are already connecting with a veterinarian, but there are 25 to 50% of animals, depending on if you're talking about a dog or a cat or a horse, that never connect with a veterinarian in their lifetime. And so a telemedicine solution in those cases, I think that's actually that access, more so than maybe the convenience aspect, will be the biggest impact of telemedicine moving forward. That as laws start to change, as expectations change, as our thoughts surrounding telemedicine and what the standard of care is, where is some care better than no care? That's a question that telemedicine is really going to cause us to ruminate on, and then looking at animals out there that are not accessing any vet care at all. Where can telemedicine providing that level of some care, where can that step in and fill those gaps? I think that's really maybe even more than the convenience factor of it, where we'll see huge impacts moving forward.
How about you, Aaron? Any other perspectives on how telemedicine will meet the need of pet owners?
Oh man, the consumer loves it. I mean, on that idea of convenience, once she understands that me as the veterinarian, that I can diagnose and prescribe remotely, for the most part, is all in. Now, I will have clients that say, ooh, I'm really concerned, Dr. Smiley, I think you need to see this pet in person. If she'd like me to see the pet in person, I'm more than happy to do that. But I usually send a text or two back and say, well, tell me a couple clinical signs. And it's the same kind of process that you work through in the exam room. Because the client is very, very well intentioned, but she doesn't always know exactly what she needs because she's not a medical professional. So in that regard, when that client can figure out what we can get done remotely, and veterinarians are very good in remote care. We've been offering it for so long. We can do it effectively, we can do it conveniently, and we can do it to better the outcomes of our patients. The other thing, as far as in that sense of convenience, I think that there's also a level of medicine that gets better with remote care. And a lot of times we don't talk about that, but arthritis is a classic one. When we evaluate that, let's talk about cats. Those cats with arthritis, what's the best way to evaluate those? Boy, I tell you what, I think it's remotely. And I'm excited to see the studies that come out to show us where remote care is actually a better diagnostic tool, a more sensitive tool than in-person physical exam.
I completely agree with you on that, Aaron. I think that there are so many things that remotely, when we're seeing animals in their natural environment, we're going to pick up on much more quickly than we do in an office when they're a bit nervous, scared, acting abnormally, and not moving around, for sure.
Sounds like the potential's pretty good for telemedicine to improve the access to care. What about the future? Where is telemedicine headed in the field of veterinary care? What excites you most about its potential?
I think that, where we're really headed, both from a practical standpoint and even when you look at what the AVMA is doing and what human healthcare is doing, we're moving to a place beyond telemedicine where we're calling this connected care or connected health. And so it becomes much more than those point-to-point interactions that we're talking about, whether it's a video appointment or whether it's a stream of text messages, where we're talking about integrating wearable devices, for example. So you start to have actionable data on a regular basis coming from the animals, right? The dogs with activity trackers, or the cattle with smart ear tags and smart collars on them. So when we get to the point where that data triggers veterinary intervention before there's a crisis, I think those are huge opportunities, and those are places that human medicine has moved or is moving. For example, with diabetic patients and with patients in heart failure, the constant touch points and the monitoring of data producing. So I think that that's huge potential for us in terms of this connected care space. When we're talking about the veterinary shortage, so back to what I discussed, was the real impetus for the start of VetNOW. The ability for these connected technologies and telehealth technologies to connect paraprofessionals, I'll call them, broadly, veterinary technicians, nurses, assistants, farmers, farm hands, people that have skills but don't have the knowledge that a veterinarian does, or maybe as many trained skills, can still provide a high level of care. And when they can connect to a veterinarian through telehealth technologies, as our laws change, as our technology improves and provides more information along the way, I think those two spaces in particular, the leveraging of paraprofessionals and the integration of more data producing devices, I think those are two spaces that over time will be very, very exciting.
I'm excited. One thing for the clients, to piggyback on what Apryle was saying, is more access to care. So looking forward to more animals having access to veterinary medicine. That's really exciting for me. And I think that can be done in part with telemedicine. And the other thing that I'm excited for is veterinarians to be able to engage in telemedicine to give themselves a better work-life balance. Veterinarians, for the longest time, I can always remember my wife and I having a conversation of, it'd be easier if you did a different job, because then you wouldn't have to be present to necessarily earn a living. Like, it's the curse of veterinary medicine, you have to be there. Well, over the last 3 years, right, I don't come into the office anymore on Saturday mornings. Now, we still see patients, right, but we're leveraging, like what Apryle was saying, we're leveraging our paraprofessionals. And so I'm excited for the veterinary community to engage in this medium that we've used forever, that we're very, very good at, but now with newer technologies.
Excellent. Well, before we wrap up, I'd like to ask each of you our Fast 5 questions. These are 5 questions that help us get to know you better. Let me start with Aaron. How would you describe your job to a child in one sentence?
Now, boy, okay, hold on, Tony. These are good. All right, I got to get my head ready. Okay, here we go. How would I describe? I take care of animals and I help people.
Very good. What is your favorite animal?
A horse.
Of course. Who are your heroes, role models in your industry?
In our industry? Oh, gosh. The veterinarian that I ran around with when I was a little guy, Dr. Updike, he was genuine in his teaching. And I can remember we were listening to a dairy cow that had hardware disease. And he said, "What do you hear, Aaron?" And I was listening. I said, "I don't hear anything." He says, "That's right? The heart sounds are muffled because the cow has hardware disease." And he was just so excited about watching people learn his trade. A real craftsman. I would say that he's my hero in the profession. And then this sounds a little bit generic, but the more seasoned veterinarians in the state of Indiana. And there's a whole group of them. But being the president of the Indiana Veterinary Medical Association, I gave a small or a short address, and I had multiple veterinarians that were a generation older than me encouraging me. And it was just a very humbling moment. And I'm so thankful that I live among a community of veterinarians that doesn't want to stifle innovation or worried about what the profession might be. Moreover, they're humble enough and they're generous enough to tell their younger professionals to go get them, right? Go get them, go get it, do it, make it better. And I just am so honored to be around them, and I want to emulate that when I get to their position in life.
Very good. What recent podcasts or books would you recommend?
Yeah, I just finished up reading the LBJ biographies, and they were fascinating. There was an interesting thing in there about Purdue with NASA and how Johnson was doing horse trading with a representative from West Lafayette, and then Purdue benefited from that. Those books were just fascinating, and how power moves. And I kind of find all that stuff just fascinating. So, and they were just really, really well written. I would say in this moment of civil unrest, I've explored more and more topics that I find I'm ignorant on. So like how to be an anti-racist. I started reading that. And to be frank, it's a book that I probably should have picked up quite a long time ago because it's a perspective that I don't have a lot of knowledge on. So it's a difficult read. It's a good read. And I'm thankful to be able to be pushed to better understand what's going on and how we solve the problems that we're dealing with in society right now.
And one final one. What is today's greatest challenge that animals can positively impact?
Anxiety, man. Right. So as Americans, I think that's what we're dealing with. And you watch an animal, whether it be a horse or a dog or even an old dairy cow, because heaven knows that sometimes dairy farmers get a little bit anxious, but they won't tell anybody. And you watch that animal interact with that human being. And there is something in my little world, there is something that God put into that animal that can be given to the person to just know that it's going to be okay. And but I just always find it remarkable for animals to step into an anxious situation and inevitably calm comes.
And one last thing for you, Aaron, do you have any final thoughts for our listeners today?
Thanks for letting me come on. And if you're a veterinarian listening and you're thinking about telemedicine, the first thing I want you to know is that you're worth it. Don't think that your medical opinion is not valuable. Inevitably, owners, after I push the charge for text messaging and asynchronous videos, they'll say thank you. And it surprised me because I fell underneath the trap and I believed the lie that my professional opinion wasn't worth anything. You're worth it. You're very, very intelligent. You're highly trained, and people are willing to pay you for that expertise. So that's the one thing. If you hear me say anything, hear me say you're worth it.
Very good. Well, Apryle, the fast 5 questions for you. How would you describe your job to a child in one sentence?
So I have 2 answers to this. When I'm doing my clinical work, I tell people I'm a dentist for horses, plain and simple. When I am doing, my telemedicine work, I tell kids that I am helping animals talk to veterinarians through video and through their cell phones. They seem to understand that pretty well these days. So even little kids understand what telemedicine is.
What is your favorite animal?
I'll agree with Aaron on this one. Horses, for sure.
Why am I not surprised? Who are your heroes or role models in your industry?
So the 2 veterinarians that led me down my clinical path are certainly some heroes of mine. Clete Griffin in Texas, and he's really the reason that I am a veterinary dental specialist, right? He's the reason that I found out that was an important thing clinically to be for horses in the first place. And there were reasons that, we should be specially trained in it, and that could be something that really, clinically lasted me my career. Then the vet, Patty Dixon, that trained me during my residency, just his passion for what he does and his passion for treating horses and for, creating innovation in the space as well is really what led me to think in a more innovative fashion. He's written more than 500 peer-reviewed papers actually in the space of equine dentistry and airway disease and things like that. And so he really led me down the innovation pathway. And, I really think that they led me to where I am today, even though I'm in a slightly, different industry now. I think as well, right now, I'm really impressed by a lot of the female world leaders during this coronavirus crisis actually as well. I think that, a lot of the leaders out there, particularly like the Prime Minister of New Zealand, for example, and the way that she's been handling this crisis has been really, really admirable too. So I'm finding some new role models as we go forward here too.
And what recent podcasts or books would you recommend?
Absolutely. So if you're someone like myself, I'm in a startup, right? That's how I view my telemedicine platform in my company, and so I listen to a podcast called Startup Therapy, and it's been fantastic for someone in kind of this entrepreneurial space, that's really dealing with things that feel quite isolating when you're first entering a new industry, creating a new business, taking on a lot of risk. And it's been very good learning that, that's a very common thing when you're in this space. Additionally, I've really enjoyed, I just listened to TED Talks frequently, a lot, on many different subjects. And I think those are pretty fascinating as well.
Very good. What is today's greatest challenge that animals can positively impact?
I very much agree with what Aaron said in terms of, reducing anxiety. I think on the flip side, animals are also a great source of food supply, right? And nutrition and protein for the world. And I think that, already we were trying to figure out how to solve for the fact that the world's population is going to be doubling by 2050. Protein in particular areas is going to be doubling, I should say. And we need to find new ways to produce those. And so I think that animals are very, very important and can positively impact the ability of people in developing nations to sustain themselves and to be, to become, productive and to continue to develop their countries and their economies. And so I think that in food production, that's actually a huge potential for animals.
So, Apryle, do you have any final thoughts for our listeners today?
Absolutely. And that is, that they should not be afraid of telemedicine. They shouldn't be afraid. And this is very much geared towards veterinarians that could be listening to this again, that telemedicine is something that is here to stay. It's something that will last beyond coronavirus and continue to develop. And it's something that you're already doing, as Aaron mentioned in the podcast and as we talked about. So when you start to get concerned about the legalities of what you're doing, when you start to, be worried about how you're practicing medicine, consider if you're able to perform it as if in person remotely, if you're able to acquire all the information that you need to remotely. And I think, beyond that, even think about, would I typically do this over a phone call or through a text message or by email with a client? And if your answer is yes to those questions, then do it. Do it in a measured manner. Do it through a platform or an app if you have that available to you, so that there is even better recording and better metrics on the medicine that you're performing. But don't restrict yourself too much. Think more about the opportunities you have to access new clients and to provide care that you didn't have before.
Thank you, Dr. Smiley and Dr. Horbal, for joining us on the podcast today. And thank you all for tuning in to this month's episode. I hope you all found this conversation as helpful as I did. If you ever want to learn more about the impact healthy animals have on our well-being, visit www.elanco.com/rediscover. To stay up to date on the podcast, be sure to join us next month.